So as I was saying, we're doing this thing where, and I don't know who came up with the idea. I'm sure a question was asked around the table. Who do we know who has hideous teeth? Well, let's get Dave Newman in on this. So I don't know whether I should be ashamed, embarrassed, or whatever. It's all good. I drink coffee. What am I going to do? It's been like 25 years of drinking coffee. Somebody suggested, hey, how don't we get Dr. Drew, he's a local dentist, really nice guy, in studio to talk about dentistry. At the same time, we're going to try to fix Dave's smile.
Nice.
I know, because look at you. You've got like perfect teeth. You had braces, didn't you?
Oh, yes.
You had braces.
Yes.
Show me those.
Well, see, nice.
Yeah, look at you. See, I'm so jealous. I don't even want to flash mine. I try not to flash mine. So here's what we're doing. It's Monday mornings. We're going to be checking in with Dr. Drew Markham, the Chew with Dr. Drew, we like to call this segment, and he joins us right now. Good morning to you.
Good morning, Dave.
I had my first appointment. First off, before we talk about your business, where are you located? How can people find you? That sort of thing. 'Cause I know you got a website and everything.
We're located in the North Kenton Mall, which is over by Independent Grocer, Walmart, that area of town.
Okay. All right. And you've got a website, right?
We sure do.
Yeah. What is that site?
It's drdrewmarkham.ca.
Makes sense, right? Because his name is Dr. Drew Markham. Okay. I had my first initial visit with you on Friday.
Yes.
Let's talk about that. First off, let me just say this. It's probably one of the night. I love the vibe that they got going on in the dentist. It's very nice. You got to go check it out there.
Okay.
Comfy seats. I know. It's nice, right? It's very, very nice. You guys have put a lot of thought into sort of how you laid out your office, obviously.
When we first picked that location, I mean, one of the things about going to the dentist is that it often feels like going to a dentist office. We have a lot of patients with a lot of dental fear, and we wanted it to feel a little bit different than that, so you have some sense of serenity when you walk in the front door.
Totally. And it's definitely got that Muskoka vibe.
Absolutely. The designer was great. We had her come up, and we wanted to maintain a lot of the natural elements of the previous office that we were in and sort of match the building, and she did a phenomenal job.
Okay. Well, I love it. I was very comfortable and at home. I especially love the fact that you've actually got a chair that massages you. Like, okay, let's talk about it. They've got a chair
That's awesome.
that massages you when you check into the place. You can sit. What is that all about?
Well, the sad part is, I think in the 3.5 years I've been there, I've only sat in it about twice myself. But, we also deal, and we'll talk about this in future weeks, with some TMJ and some chronic pain issues, TMJ being your jaw joint. And we have a lot of patients who have issues with that. And so when we're treating that, we want to make sure that they're completely relaxed. So it's just a nice way to have them get a little pre-relaxation before they come in to see me.
Okay, so you've already brought up a point then that I was going to talk to you about, because he's already thrown terms at me about TMJ and all the rest. TMJ is what?
That's your jaw joint.
That's, for someone like me, I have a very clicky jaw. When I open my jaw, it clicks and kind of pushes to the left.
Very common.
A little bit. All right, that's common. So, and here's what I'm gleaning from my first visit with you was, we kind of just didn't talk about my teeth, right? There are other things going on. Is that...
Absolutely.
That's the whole thing with oral health, right? There are other things going on if you got it going on with your teeth.
Absolutely. I mean, it transcends into all parts of your body, and I know that, again, in future weeks, we're going to be talking about your overall health being related to your, dental health and all the different bacteria that can be present in your mouth that can travel to other parts of your body. We're learning more about sleep apnea and just how your facial growth and development affects how you breathe. So yeah, I mean, you're not just a set of teeth attached to a body when you come to the office. There's so many things that could potentially be going on. We want to make sure you know about all of them. By
the way, we're going to be, because I've talked about my sleep apnea on this show many times. We're going to be talking about that over the next few weeks, about how Dr. Drew can help you if you suffer from that sort of thing like I do, and they're going to try to help me with all of that as well. But we will be talking about that because that's kind of a big thing.
For sure.
Yeah, absolutely. Okay. Well, I got to think that most people I don't want to offend you when I say this. Do you and other dentists like you have complexes because you think people hate you?
You won't last.
People fear, because here's the thing, right? A lot of people fear dentists. Now, does that weigh on you?
I consider it a challenge in the sense that, if you have that sort of complex, you're not going to last very long. I mean, dentistry in terms of history, has done some pretty brutal things to a lot of people that sticks with you. I've got 70-year-old men who are on the verge of tears walking into my door.
For no reason at all, because dentistry's changed so much, right?
But those memories of being 6 years old and not being frozen and having, being ridiculed and shamed by the dentist, they stick with you, in some cases, forever. So, it's our challenge to make you understand that we're there to help you, and, we'll take the extra steps necessary to give you some comfort and some control in the chair so that we can get through what we need to.
All right. Well, here's the thing that I also loved about the appointment. You went through all of my problems. I've got some problems. I've got some problems.
Really, Dave?
You went through all the problems, and then essentially what you would do for most people is you lay out the entire spectrum, say, hey, here's what we see, here's what's available to you. Now kind of the choice is yours.
Yeah, as I get further along in my career, I realize that I think dentists have a pretty difficult job in that, when you go to your doctor's office, if you had the unfortunate circumstances where you had heart disease, diabetes, and a kidney problem all at the same visit, the doctor's going to tell you, man, Mrs. Jones, this is not your day. You have a kidney problem and heart disease and diabetes. Whereas historically at the dentist, we have a bit of a complex about being rejected. And because a lot of the stuff we deal with is painless, when we put forward a number of different areas, we're always concerned that we're going to be perceived as selling you something.
Right.
But, when it's my ethical and moral obligation to tell you everything that I see that's going on, and then it's your decision as to what you choose to do. And that may be nothing, it may be everything, it may be somewhere between, and that's okay.
Okay. All right, good. All right. Can you tell, as a dentist, when you come in, and when I come into your place and I lay in your chair, and you ask me if I've been flossing, can you tell if I'm lying? If I'm lying, will you be able to?
That's a great question.
Right? Can you?
Yes, and it's,
You can. So when you say, Dave, have you been flossing? I say, yeah, absolutely, Dr. Drew, twice a day.
The hygienists are amazing for that, too. And we, dental humor is one of those sort of bizarre things that we will sometimes, when we're having a morning meeting, sort of discuss. And there are people that, they say, oh, yes, I flossed this morning, and that,
meanwhile,
and I used to do it myself when I was a kid. I remember going and I had braces on, and you knew they were going to be checking, and you always think.
Meanwhile, my gums are raw and bleeding because I've been flossing like a crazy fiend 5 minutes before the right. You guys know that. You know that. I'm going to be true.
Yeah, there's other sides.
That was a great question.
Well, listen.
Now I know.
I always kind of feel. I want to tell the truth, but then if I tell the truth, am I going to get lectured on this?
I know.
By the way, I didn't get lectured on Friday by Dr. Drew and his staff. Your staff are awesome. All right, this is good. So you're going to join us next Monday. I'm going to see you guys this Friday. We're going to try to fix this thing.
We're going to get started anyway, yeah.
Is it can we do this?
We can handle it.
Really?
Absolutely.
Really?
Oh, now. Come on. This is years.
We need a before picture.
Well, we'll get it, and then we'll get the after for sure. All right, the website again is?
DrDrewMarkham.ca.
Are you comfortable with people calling you Dr. Drew?
Sure.
All right. Sound like I'm Dr. Drew. Okay. Thanks for coming in this morning, and we'll see you on Friday.
Sounds great.
And then we'll have the follow-up chat on. What are we doing this Friday? Do we know?
You're seeing the hygienist who's going to tell whether you've been flossing all week or not.
No!
Can't lie now.
All right, it's Dr. Drew. Check out his website. You can check our website for more details. We're going to pimp my smile over the next few weeks, and we'll see if we can get these things pearly white. It's 8:25 with a big breakfast.